and we're going to start out to talk about the survey that we did in November of 2020 on the impact of COVID-19 on worksite health centers. And then we're going to take probably about 30 minutes or so to go through these results. We'll take questions afterwards if you'll use the Q&A box. And then what we'll do is in the last half of the hour, we'll take questions or comments from those who are participating in the webinar here. We've got members of the NAWHC Medical Director Council who are going to be on the call, who could answer questions relating to COVID-19 or practices in your worksite centers and challenges as well. So with that, again, I'm Larry Boris, the Executive Director, and I'm going to share my screen so that you can see the slides. Also, a copy of the slides will be available to everyone on the call, so you don't have to take too many copious notes relating to that. So let's get started here. Let me just expand this to a full screen so everyone will have a chance to see this. Some of the numbers are maybe small, but it will, as I said, we'll be able to go through that for you pretty good. Okay. The update here, as I said, was conducted by NAWHC, was done in November through a SurveyMonkey. Our organizations, for those who are new or who are not familiar with our organization, we're a 501c3 nonprofit group. We're focusing primarily on the on-site, near-site, mobile, and virtual health centers sponsored by employers and unions. We also incorporate the third-party vendor and health provider community and consultants, brokers who support these efforts. And we also have a variety of nonprofits who are part of us as well. We do help employers understand this benefit strategy and how you can get engaged in this, as well as helping employers evolve their centers beyond the initial scope to offer primary care and even up to a primary care medical home as desired. We offer a variety of educational programs such as this one, benchmarking services such as this survey I will be describing today, and a variety of resources to help people understand what's going on in the marketplace, who the vendor community are how to measure and report and evaluate these centers, and basically to stay on top of what's going on in the industry. You're welcome to visit our website at www.nawhc.org or our LinkedIn group, which is National Association of Worksite Health Centers, for information. There's a lot of good information available for the general public, though our primary resources are limited to our members. If you're interested in that, please, again, get information on membership from that site. Do want to let you know we are having our annual forum, our 9th annual forum, September 9th and 10th, our fingers crossed, in Chicago, to hopefully the COVID-19 vaccines will be widely available and people will feel comfortable going to meetings. Just as an aside, anyone who is registered for the meeting that we are helping promote in Phoenix on January 20th and 29th, that meeting has been canceled and there will be being run later in the year. Look to our website for more information about that. So, as I said, the survey process was in initially March. We did conduct a survey of our members and clinics partners about the impact and challenges of COVID-19 on their worksite centers, on-site and near-site, and their staff. We wanted to see then at the end of the year how these challenges and issues and their services have changed over time. So we did conduct a survey. We did not, unfortunately, focus on those who had responded to the first survey. We got similar numbers. We had 49 people respond to the first survey, and we had 41 respond to the second one. We probably should have contacted the same ones earlier to see how they've changed, and probably we'll go back to that later on. But just so you can see what the responses are, we've had 63% came from employer and union sponsors, 28% from our clinic providers and vendors, and 9% from others, consultants, brokers, etc. Wide representation of industries that are available, and the responses come primarily from the larger employers. Most of our members and those who have worksite centers are self-insured, so they tend to be larger, though we have members as small as 200 who have a nurse or someone come on board periodically. But as you can see, most of these respondents had over 1,000 employees participate in the survey. So we broke it down. We also asked our clinic vendor providers, and there's over 30 clinic vendors in the industry. Not all of them, of course, responded here, but we asked them about covering essential lives. NAWHC has been in contact with the CDC and Operation Warp, uh, and we're trying to identify those essential industries and those workers because that's where they want some priority for the vaccine. So we asked our vendor partners who they covered and the amount. As you can see, quite a number have these kinds of representations. If you look at total lives, probably our vendor partners cover over 10 million lives throughout the country altogether. So we ask employers, and what you're going to see here is I split this out so that most of the questions are answered from an employer union perspective, the health center sponsor, but in some broader cases, I included the vendor responses as well. In this case, we asked for the individual employers, how many centers that they offer to their total population. As you can see, most do have just a single center, typically at the headquarters or largest location. But as this benefit is deemed more popular and effective and valuable, it is expanded. And as you can see, we have some employers offering multiple locations. Sometimes it's an on-site, but typically it may be a near site or even a virtual center being offered. Our members and the vendor community makes recommendations, but our members, each employer and union decides who's eligible to use the Worksite Center. Typically, it is those employers covered by the health plan, but you can see we also have a variety of others who are utilizing it. Spouses and dependents tend to be the highest cost group for many employers, and so they are encouraged to use the center. And we even have some centers who have pediatricians available, so they're seeing even infants and others. Typically, also you see others, larger employers offering coverage for anybody who's on site, workers, contractors, etc. Even some retirees have the opportunity to take advantage of the center. Staffing models vary. If you've seen one employer and you see one center, you've seen one, but there's some broad areas. Over half of our members now use a physician, nurse practitioner, physician assistant approach or with a medical assistant. Our centers tend to size-wise run from as small as 200 square feet to 25,000 square feet. So a very broad scope of practice sometimes is provided. But you see many of the centers are run by mid-level practitioners overseen by a physician or just a nurse coming in. And so these are the centers that are providing the care on site and also are able to go to the local call centers, the factories, the lunch centers, wherever people are working to deliver the care. Utilization, we asked how it's changed since the beginning of the pandemic to now. As you can see, 30% have had a greater utilization than in the past. Some have had a lower utilization, and some haven't been able to track this at all. Status of the workforce, you can see dramatic changes, of course. Back in March, fewer people were working on site, more people were working from home. Now that's flipped over. But in manufacturing plants, you still have a lot of people still working from home with the people who have to be on the site primarily there. The centers have adjusted their services and their hours to make sure that people are handling it. We asked about the center itself. Again, we see a flip here. Over half of the centers are now operating pretty much full capacity, full time. Back in March, many of them were only on telehealth, offering telehealth services, as was the staffing, but now that's flipped. Interesting to note, none of our members ended up closing their centers, either before or after that. Even with the large number of people who are utilizing the telehealth or virtual care, because over 80% of an employer's cost is from the chronic disease of about 18 to 20% of the population. It's really critical for employers to maintain the center services even during this very difficult time. And so the centers were still a very vital cog for employers. Our November survey also found about 58% of the centers are offering only appointments and no walk-ins. And clearly, people are still offering services for those even without the virus symptoms. As we'll see later on, they still want to provide the services that they can, but they're trying to be safe about this as well. Staff has switched somewhat. Many of the staff have the same role. Back in March, many of the staff almost 80% from our previous survey actually were transitioned to telehealth. Now we're finding that telehealth is still being used, but many, again, are seeing people on site and are available there. The services are offered of mostly, again, COVID-19 screening is important, though we'll talk a little bit more about that in a moment. As you can see, they do mostly at that time, and even now we're doing telephonic screening programs, prescription refills, because again, chronic disease is just so critical. It's very important to make sure people are getting their medications, whether it's just dispensing or in some cases our centers offer full-time pharmacists who are there. Virtual visits clearly are here and are here to stay. Again, just as an aside, I think even when this is all over, the value of having virtual visits, being able to get access 24/7 or at extended hours at a minimum from the center staff or partners that the center works with is really going to be critical. And people have learned to trust it, learned to enjoy it, learned the easy access, and satisfied with that. There's still a lot of management and screening that's being done through the centers, but clearly more so at this point. As far as testing, we asked about COVID-19 testing in general, and back in March, about 55% of the centers were doing it. Now we're seeing more, and I broke it down because there's different types of testing that's being done, depending upon, again, the staff and your services and the ability you have to have certain resources. So you can see here the large number are doing the in-lab PCR test, which is the most interest of many employers. And the employers are getting their directions pretty much from their health provider and clinic vendor partners on these kinds of issues. So they're taking their recommendations and following through. Just again, as an aside, about 28% of all centers are run and managed totally by the employer. About 60% are run by third-party clinic vendors, and there are about 30 of them out there. And about 18 to 20% are run by hospital systems, medical groups, even individual physicians. Return to work, of course, is a key area here, and reviewing the results of the screening is being done. Other services, we didn't ask about health coaching back in March, but now over 50% of our participants are doing health coaching, over 60% wellness coaching, and even physical therapy and chiropractic services are being continually offered. And not just in person. Again, through telehealth, we're seeing telechiropractic, telephysical therapy are being done, and a lot of this stuff can be done at the home. And I think moving forward, we are beginning to see, and even some of the vendors are focusing on offering the telehealth services as an initial triage that people can get immediate access to a provider, and then they determine whether or not those individuals who are being reached by telehealth or virtual care need to see a provider in person. And so it becomes a triage way to do it. Again, allowing people to get more quicker access to providers and allowing the centers to triage and identify those people who truly need to see somebody on site. So we ask about what kind of collection methods are being done. You can see the different part, the nasal swab continues to be the largest type of test that's being done. But you can see other kinds that are still being used. And again, as we learn more about these tests, what the results show, how accurate they are, how easy they are to use, what kind of equipment you need, what kind of labs you may need to have on site or that you partner with, these might change over time. But as you can see, this is a direction people are taking. And again, the different centers and the vendor community may have their own recommendations on what they like best and what works best for their client base. As far as the entity responsible, clearly most of them are the center staff themselves. Sometimes they're contracting for COVID-19 services to an outside vendor, and some are using public health. But what's interesting for me is that when we've had a number of discussions with the CDC and Operation Warp Speed about the interaction between public health, what they call jurisdictions, the county, the state, and some municipal health departments, and employers. And we're finding that very few employers have been contacted by these jurisdictions, the public health departments. And yet we represent a significant part of the public health system with the kind of testings and services offered. So I would encourage people, if you've not already reached out to the public health entities, do that to make sure that you're getting the benefit of the resources, services that they have. We ask about charges because, as you know, there has been an opportunity to waive the charges for COVID-19 testing and treatment under law for those particularly who have HSAs. And as you can see, there's no charges by most employers, but some still, we feel that there's a need to have some skin in the game. And so they still make some charges for the employees to take advantage of these kinds of services. If the tester is doing virus testing, we asked about the source of the test kits. Getting materials and supplies has really been a key ongoing challenge for employers. As you can see, about 58% get it from private sources. One of the challenges, as you'll see later in this presentation, is employers are really concerned about the quality of the test kits, the masks, the other protective equipment they get. There's so many now vendors out there outside the U.S. that are making these supplies available. And there's some questions about the quality of that. Employers and vendors are often challenged about finding out who is offering good quality services and products. That's something that they'll be looking for guidance from. And again, we've been talking to CDC and others to help us with that. We ask about screening apps. So there are a number of vendors out there who are offering now screening apps for COVID-19 so that workers would look at these apps, do a self-test, so to speak, answer a series of questions before they would come into work, and then that information would be reviewed. Most of our employers are not yet using that. It may be growing again as people get comfortable with them and the results and how to take advantage of that. Some employers are taking advantage of what the state or even their health plan may be offering. We ask about doing mass screenings. We asked about that back in March, and we asked about it now. As you can see, most employers just are not interested in conducting mass asymptomatic screenings of their population. Some are considering it. They want to know whether people have the COVID-19 or have the symptoms, but doing mass screenings is not something that people are interested in. If they would do it, they probably would do it at the center or with cooperation with the local health department. As far as concerns, this is really important. When we ask people, why you're not interested in doing testing, we can see that the safety of the entire workforce, and particularly the safety of the worksite center staff, is really important to people. So bringing sick people on site, and even with the recommendations and the changes people have made in the reception area, in the office center areas, there's still concerns about that. There's concerns about, again, obtaining the test kits, making sure the staff who sees people who may have symptoms are safe. The exposure, having to keep the place constantly clean, obtaining the right kinds of equipment. Not so much on the legal aspect, but there still is some concerns about that. But even what do you do with those results, reporting the results, the accuracy of the tests? These are all things that are being concerned about. And again, let me just stop a moment and say, if you do have questions, please click on the Q&A or the chat feature on the Zoom box that you're viewing this webinar and submit those. I do have a list of registrants. What we might do at the end of this is go around the table. I might call people's names out if you have questions, but otherwise, we'd like to use this program as an opportunity for you to get information and learn about things that you're questioning about. So let me continue. As far as reporting, this was an issue for many employers wondering, should they or do they have to or can they report the results of tests to HR? Because this is a safety issue. It's a workplace incident issue, perhaps. And so these are the responses we had. So back in March, about 46% of employers were allowing their providers in the centers to report the results directly to HR. That's gone down a bit. Those who were prohibited reporting, that has gone down dramatically. We did not ask specifically in March about these things, but as far as reporting to the health department or getting patient consent or asking the patient to report, those are areas and policies that employers are adopting now. And of course, they really want to make sure that they're following the law. They don't want to breach confidentiality unnecessarily. This is personal health information. And so they want to make sure that it's protected appropriately. But the current laws under COVID-19 do allow this reporting because there is a recognition that the safety of the workplace is key, and it's really important for you to know, in fact, whether or not people have the condition or not. As far as immunizations, and this is a key area, as I said, NAWHC has been in communications with the CDC and others, and they do have a variety of units at those at the CDC and at Operation Warp Speed, and then the new administration that are going to look at coordination. They're going to want to find out how best to distribute the vaccines. As I said earlier, we are not finding health departments reaching out to employers, so there is a list of immunization managers for every state. And if your organization or as an employer or vendor, you want to be participating in the distribution, I can have that list made available. We will post it on the NAWHC website. What I've found is that if you're a multi-state employer or you're a vendor who have clients in a variety of states, there is no national single entity that you would contract with to deliver the result, to obtain the vaccines that I'm aware of. We know that the government is using CVS and Walgreens as national distributors for certain locations, but it's been recommended to me by the CDC that anyone who has multiple sites need to go to the state, the county, or in some cases the municipality of their health department to contract to be an entity that distributes vaccines. Regardless of that, the results here, as you can see, most of our employers are interested in getting the vaccine to their people, whether the center does it itself. Most of the vendor community is very interested in participating. Many of them have the ability to store and to distribute and immunize. Some employers do not have that storage facility, but most of the employers do vaccines. They get it from, they dispense medications if they don't have a pharmacy on site. They do allergy shots. They currently are already doing adult vaccinations and flu vaccinations. And so this is something that they'll continue to do. Some employers are looking to contract outside with a third-party vendor, or again, participating in the health department. Very few are interested in not getting involved in this whatsoever. As far as repositioning staff, as I talked about earlier, most employers and centers were using telehealth services for their staff, transitioning there now. It's about, almost half have adopted it back to their typical role in the Worksite Center, though continuing to use telehealth as a broad approach. Those who don't know it, it's typically the employer who has has a third-party vendor doing their clinic, so they may not know specifically what's happening to the staff. But you can see that the staff is heavily involved, and is participating in a variety of roles here. As far as obtaining equipment, this continues to be a challenge. In March, it was much worse than it is now, but getting the mask, the N95 and regular mask is a major issue. And again, as I commented earlier, finding out who those quality sources are to get this equipment is really key, and something that all of our members are interested in and helping out. And if people have good quality sources that they can recommend that we should be posting on our website or letting people know about, I would appreciate you sharing with us. Other kinds of equipment, it's less of a concern than it had been in the past. As far as diagnostic case miss, we asked people what's changed since March earlier this year. Over half apparently don't know, but the members are clearly seeing more behavioral health issues. Preventive care has been delayed. There's been other kinds of conditions. There's been a concern about the worsening chronic disease and other problems, certain things that have had to be delayed. And so these are areas that the centers are going to be looking at, and I think we'll have to address in the future. When we look at appointment types, again now, as far as the end of November, over half weren't postponing anything. But you can see many of the key areas to prevent care, to monitor people, were being postponed, and they are continuing to be postponed, though the vast majority seem to be bringing on all services as much as they can, as they can continue to have staff available. But these things have been postponed by a smaller and smaller percent. So we think that the worksite centers in general are getting back to major operations, back to where they were prior to the endemic. We asked in general our employer members how their partners have functioned. And to a large extent, and a lot of them have felt that over half, they've done above average. Average really stepped up to the challenges that have been here. Particularly, some have been very impressed with the ability of the physicians and staff to really help out in a variety of operations, to be really agile, to move quickly to transition into telehealth and other areas. And so I think we can applaud our partners, the third-party vendors and health providers who are supporting employers, really done a good job. It's been a challenge. Everybody's recognized that. You've had to be nimble here, and we think that this has really worked out pretty well. This is a busy chart, but we asked about the telehealth because there's been so much interest here. Again, the way you read the chart, you can see on the top, different, on the left side, the different types of services that would be offered via telehealth. Excuse me. And then the different colored bars shows the percent who have responded in that area. On the bottom, you can see what the response means for each area here. And so you can tell where it's been most utilized for these different kinds of services. As far as the impact on the future of centers, most employers have indicated they will be increasing telehealth. They will continue their centers. Nobody's talking about closing a center or diminishing its services to any large extent. The vendor community believes that there's going to be more interest in these centers and they will be expanding. There is not a diminution of the need to see people in person or on site. So I think this only, again, has recognized the value of worksite centers, of having health providers on their site for a population for easy access, virtually little or no cost to them to improve productivity, reduce absenteeism, and stay on top of the quality of care being provided. We asked finally about challenges that lie ahead. And these are the things that employers and our vendor community are concerned about that we have to try to work together to help them. And NAWHC will be using its resources, making available programs like this one, publications, resources that we'll be posting on our website. And so again, just these are some of the areas, and perhaps we can talk about some of these, or people have questions about it, how to maximize the use of the centers during this difficult period, best practices and vaccine sourcing and rollout reporting, et cetera, how to protect the staff, how to keep staff healthy and participating, how to address the needs of the staff as well as the employee population and the difficult behavioral health issues. We see this as really one of the top areas that employers are going to be concerned about because their employee population is concerned and in some cases actually afraid to come to work. We also need to find out how we can help manage these cases. Not all centers have case managers. You really have to find ways to help coordinate the services and the testing and the outside work that's being done. Quicker results and more accurate results, getting access to the vaccines and the other tests is really important. Getting the vaccine and being able to have plans together to develop that, finding out what are the pods, the sites where the vaccine is being distributed, such as I'm in here in Arizona. So they're using the Cardinals football stadium 24/7, being able to let people know what's going on, working with the local health departments, whether it's your county, state, or municipal one, learning about the implementation, learning about the impact of COVID-19 and all its different variations, what's going on with the new strains as well, helping people in their total care and getting programs for those who still aren't sheltering. So with that, I'm going to stop there. That's the conclusion. As I said, these results will be available for all those who participated in the program. We will also post it on our website. If you want more information about the COVID-19 resources and what NAWHC has to offer as an organization in general, feel free to contact me generally or go to our website at nawhc.org. At this time, what I'd like to do is to go about some of the questions that anyone would have. One question was that says our consulting group has been reaching out to local hospitals, public health agencies, et cetera, in the Southwest, but have not been successful. Are there any recommendations? As I said, what I do is I will post on the NAWHC website. And what I'll do is I will send out to everybody on this call who's registered a list of the immunization managers around the country. Uh, and, and then you can reach out to them about getting the vaccine or how to participate and getting your workforce involved. And I think that's the best way. Uh, the hospitals, I think, are overwhelmed with COVID-19 cases. They're really not interested too much in doing testing or vaccines for the outside community at this point. Their staff is really tied up. So it's really the health departments you have to go to for more information on the vaccines and then testing as well. There was also someone commented in relation to obtaining vaccine for clients. Same response. I would strongly recommend that you reach out to your local health department. If you're in a large community, there may be a municipal health department like in Orange County or in Chicago. But I know typically it's going to be the county or the state health department. You can go to their website, but I will send out the list of the immunization managers for that. Are there other questions? Again, please send those questions through the Q&A center or through the chat feature. Diane, do you have any other questions that you can see?
I do not have any.
Okay. Well, if there's any other questions or comments, you can send those to us afterwards and we'll get back to you on that.